Fuchs for joining us today on this Safety Sessions. As a reminder, Safety Sessions is a series presented by the Southeast Athletic Trainers Association to help bring awareness to practicing safe sports. SEATA recognizes preseason and the months of July, August, and September as high-risk times for athletes as they return to sport in high temperatures. The SEATA Marcom Committee, or the SEATA CEC, is presenting SEATA Safe Sessions in support of athletic trainers, athletes, and their coaching staff for the month of August on the following topics: heat-related illness, CPR and SCA, spine boarding best practices, and concussion safety. So, Dr. Eric Fuchs, if you don't mind giving us a quick introduction of who you are, what you do, where you work, and why you're here.
Okay, well, first, thank you to SEATA for this opportunity. My name is Dr. Eric Fuchs. I am the Department Chair for Exercise and Sports Science and a professor in athletic training education at Eastern Kentucky University and an adjunct faculty in our Bachelor of Science of Paramedic program. I'm a certified athletic trainer. I'm also a National Registry Advanced Emergency Medical Technician. And I've been practicing for 25 plus years in both fields, both in EMS as well as athletic training. And I currently clinically practice with football at EKU, as well as am the medical director for Festival Sports Inc. that puts on 2 large youth girls volleyball tournaments, about 680 teams twice a year. And then I'm also an associate expert for the Rayburg Conan Group, which is a sports medicine risk management assessment firm and provides legal consulting as well. So that's kind of my background. And of course, my research areas are in the emergency care of the critically injured athlete as well from a research standpoint.
Great. Thank you so much for being here and sharing your very broad expertise with us. As we move into preseason and one of the most dangerous parts of the year, we wanted to bring in an expert such as yourself to answer some questions for our athletic trainers and coaches. So to start us off, give us a rundown of current CPR BLS guidelines to remember as you kick off the fall.
Well, this is a great question as far as current CPR and BLS guidelines to remember as healthcare professionals. The biggest thing that I'm going to emphasize is, of course, good chest compressions, which is that CABC, that circulation part of it. You need to do good chest compressions and then very, very good airway management with the basics. Really make sure you know how to open the airway, the head tilt, chin lift, or jaw thrust, depending on what the injury is to your patient. But being able to do those and opening an airway is critical to getting good breathing going. And I recommend that you're always carrying a pocket mask and an MPA, a nasal pharyngeal airway. Those are my go-to airways because I can put it on a conscious patient or an unconscious patient to make sure I have a good airway. I don't have to worry about a gag reflex. It's a great go-to. And they both can fit in your fanny pack and be with you at all times. The other big thing is have an airway bag, a kit or something that's designated as airway, and it has all the stuff you need for good BLS care. And that includes a bag valve mask, your MPAs or other supraglottic type airways, if in your state you're allowed to use them, that they're there and ready, and have oxygen available and have the oxygen adjuncts, whether it's non-rebreather masks, nasal cannulas, nebulizer masks for your asthma patients and the meds for that, if you can administer them in your state. And suction, here's a big one. Don't forget about suction. That's a big one that I think sometimes people forget. A simple manual suction device. If you have a battery operated one, it's heavier, that's fine. Just make sure you're checking the batteries daily. And really work on your basic airway skills of getting a good mask face seal to be able to ventilate, whether it's mouth the mask or with the BVM. And then that high quality CPR compressions. Those sound like basics, but again, managing an airway with BLS, again, in most patients, whether they're trauma or other, is going to increase survivability of that patient. So those are the big things. A couple other things to make note that everybody hears, but AEDs, make sure you're doing your maintenance checks on your AEDs, check your battery, run any system check your manufacturer requires, and then check the pads. Pads expire. If they're expired, make sure you're getting new pads. And where is that AED access? Are those doors unlocked? A lot of times practices are going on at times when buildings might normally be locked if you're at the high school setting or even collegiate setting. Who has keys? And then review your EAPs as it regards to CPR. And I can't emphasize that enough. Make sure everybody knows their responsibility in the EAP at the beginning of the season. And practice. How long does it take you to run and get your AED? Do you know where it's located? Has somebody actually run that? And do it rehearsed, do it unrehearsed. Tell somebody to run to the AED, see if they can get there. And then the other big emphasis from CPR is if you have the resources, the team's approach to CPR, sometimes referred to as the pit stop crew method. Each person knows which role they're going to take and they do that role. If you have larger resources at the college level or at a high school with multiple staff, are you training in that team approach or pit stop crew method? Also know this from an EMS side. EMS, if CPR is in progress, when they show up, they're likely to stay there and work on your patient and your athlete for a significant amount of time, because current trends and evidence is better CPR is done at the scene. And so they're going to do high quality CPR and ACLS or advanced life support stuff on scene. They're not just going to grab that person and run them to the hospital. And a lot of people, if you're not prepared for that, are thinking, why aren't they taking this person and moving them? Because they're trained to stay on scene and work that patient in a cardiac arrest for a pretty good significant amount of time. So be aware of those things. That's what I have for that question.
Awesome. That's fantastic. I love the pit crew analogy. It's a fantastic way of putting it together. So our next question are, what are some of the most common life-threatening situations that ATs are at risk of experiencing? I'm assuming with a patient, not themselves. And secondary to that, what is something that is out of the ordinary that ATs may not think about in an emergency?
Okay, well, I mean, the most common life-threatening situations that ATs are likely to experience among their patient population are your sudden cardiac arrest events, whether that's from some type of cardiac arrhythmia, whether it be long QT or hypertrophic cardiomyopathy, some type of congenital problem there. But don't forget about asthma. Don't underestimate asthma. It is a life-threatening condition. Of course, exertional sickling and heat stroke. And while I know you've had an expert talk about heat stroke and we know to cool and all of that, which is all important, but what do you do with the heat stroke patient that you're cooling that then goes into sudden cardiac arrest? You're going to have to move to CPR. So you've got to think about those things. And then anaphylaxis. Anaphylaxis is another big one that you're likely to run up against. So those are some of the more common life-threatening conditions I think you could see during preseason. But what is something out of the ordinary that ATs may not think about? One is, from the heat stroke, everybody thinks about, okay, I got to cool them. How am I getting them to that cooling station? But as I just mentioned, if they're in the cooling and they go into cardiac arrest, do you have a mesh stretcher underneath them that you transfer them so you can get them out quickly and get into doing that CPR? Do you need more than one area for and more than one airway bag and emergency care set up on your fields? Because if you've got two fields going with football and you've got soccer over on your right, and having worked at the high school level, you may have multiple, or at the college level, you can have all your emergency equipment in one area, but is it where you need it to be? Do you need multiple setups, or do you need it all on something mobile that you can get from one place to another? Other things, just know that things are not going to go as planned, and you need to plan for that by being calm and thinking through the problem. Okay. I'll give you a real life example that happened to one of my former students a while back, but during a football game at a local high school, his dad had a heart attack in the field on the visiting side, and he knew where the AED was because the school he was watching was his old high school. So he went over, told the athletic trainer what was going on. They got the AED. They started CPR on his dad. EMS was called to that high school. And this is an example of what people don't think about unless you physically rehearsed your emergency action plan. When EMS got to that school, they couldn't enter the gate to enter inside the stadium. The gate was open. It was a double gate. No cars were blocking it. But why couldn't it get through? Because the rigs in EMS and in larger cities have gotten bigger. And that small double gate could not fit the new large size EMS units physically through the gate. So that's something unexpected that you might not think about, but that's the reason to physically rehearse with all parties when you can develop that relationship. Also, when an emergency is going on, are you watching out for that second emergency? If practice is just moved off to the left, what happens if somebody else goes down? Or those of you that think, oh, I'm going to stop practice, coach stops practice, kids go over here and are drinking. Well, you're dealing with this emergency here. Maybe it's sudden cardiac arrest, but a kid's over there by the Gatorade station gets stung by a bee and they're having an anaphylactic reaction. I know nobody wants to think about that, but even when things are stopped. So who is the person, if you have the resources, that's going to manage that in your EAPs? Who's second up? Even if that's a coach, they need to know what to do. So when we're thinking about things that you don't think about, those are some. Mm-hmm. If it's a trauma incident, after you've managed that, don't forget about the kid who maybe delivered the hit. What's their psychosocial mental state? They may need some psychological care there, mental health care for that. And then the other big one is going in that same vein is don't forget about psychological emergencies. What emergency action plan do you have if a student threatens to commit suicide or has suicidal ideation to you in your AT facility, talking to you? What does that EAP look like? Those are some emergencies. Sometimes I know we're talking a lot about mental health and we're seeing a lot more of this, but what is that EAP? So those are some of the things that I would say that outside the ordinary that ATs may not think about in an emergency situation.
Awesome. To follow up in regards to the example you gave regarding the bigger EMS, that they're around these days. For that situation, what do you recommend as for the athletic trainer to take to their athletic director, whomever that needs to make these updates to the facilities? Do we as athletic trainers formulate the EAP to have a different location, or do we go to our athletic directors and say, hey, we need bigger gates?
I think everything you mentioned there, from talking to the ADs, is there another entrance that this vehicle will fit through? Are there ways to widen this? Is there a different EAP that no, they're going to come to the gate and they're going to have to walk in, but what's that look like from a time standpoint? Also along that same lines is, you've got to have that open communication and relationship with the EMS to have rehearsed it to see that it's a problem.
Right.
So I think all the discussion points is you do need to bring that up. And if the AD is not listening, then you need to maybe talk to, if you're at a university, your risk management office, counsel's office, somebody that's going to listen. But I think most ADs will listen to it, but sometimes nobody even knows it until it's too late. And so find the problem first, but ways to address it would be any of those options. Is there a different gate or entrance that needs to be unlocked that it will fit through? That saves money and there shouldn't be anything wrong with that. Or do we need to widen the gate somewhere?
Awesome. Thank you. To our next question, what are the top 3 things you would think all coaches should be aware of regarding emergency response as we kick off the fall sports?
They need to know the emergency action plan, and the coaches, need to have rehearsed it. And they also need to know what their roles are if the AT, the athletic trainer, is not present. At a high school, there may be 1 or 2 ATs, and you're not going to be at every practice that's going on a fall day. You just can't physically be at all of those. So they can't just say, oh, I'm going to call the AT over from wherever they're at. They've got to start in that process. So they need that role. The next one, they need to know the location of their closest AED. And then the last thing is they need to know any allergies, significant medical conditions such as sickle cell trait, anaphylaxis, asthma of athletes, and location or access to that athlete's individually prescribed EpiPen or inhaler and things along those lines. So I would say those are the top 3 things that they need to know.
Great. What do you consider to be the biggest issue or challenge for athletic trainers in August or this preseason? And how do you suggest they combat that?
Well, I've got a few, and maybe one that people don't think about. They think about it from one perspective. So the biggest issues or challenges in August or preseason, and how do they combat it? First is the long days. That makes for fatigue, and fatigue, including in your routine. And maybe not being as sharp, the more tired you get, the more fatigued you get in making sure you're checking your emergency equipment, making sure that you're checking and setting up everything, and that things get restocked after emergencies. It's that fatigue that can be challenged. And it's also going to impact your ability to perform your skills and to be able to think well. So, and think clearly. And we know this, I mean, medical residents, they've cut back on the amount of hours they can do because fatigue was affecting patient care. So we need to take care of ourselves, and that can be very, very challenging and hard. The other things is all the different things that you're trying to check on, whether it's daily checking the way in and way outs, because that data is being collected, but how's that being communicated and tracked to the patients that are down in weight, haven't gained it back, and as the days wane on and you've got hundreds of athletes, maybe at a high school level, even at a collegiate level where I'm at, staying on top of that. Also, the new athletes joining rosters, because we've all had this, right? Coaches are adding, or somebody moves into the district that's new, really still taking the time to thoroughly review that new athlete or patient's medical history, and updating. If you have emergency cards, are you updating with the new athlete's conditions and staying on top of that? Setting up for multiple venue emergencies. It's great to talk about having an airway bag and all that, and you have it out at football, but what if you're called into volleyball, into the gym for a sudden cardiac arrest event? Planning for that from a resource standpoint, and then monitoring the weather, whether it's wet bulb globe, whether it's lightning. And then what I think is the biggest thing is communication, especially if you're at a high school and you're one AT. How are you getting communication of issues and stuff that athletes from various practices that you may not have been at? How are those coaches communicating that back to you? How are you communicating people that need to have modified practice for things that could put them at risk for some cardiac things? So those are kind of the things, but fatigue being one, and thinking about that fatigue of, if you're tired, can you react as quickly, think as well, and care for your patient as good.
Awesome. Great. I love that reminder that, just like when we're flying, they say, you have to put your mask on first before you can put the mask on someone else. So we have to take care of ourselves first before we can take care of other people. What would you suggest for parents, guardians to do and watch for with their own athletes to encourage safe sports during this time of year?
For parents, a couple of things. First, if you think there's something wrong, then be talking to your child, talking and say something. Say something to the athletic trainer if your school has one, your healthcare provider. But if you think something's wrong, talk to their own child and find that out. Open those communication lines. Encourage them to eat and drink, making sure they're getting proper nutrition through the day. They should be eating because they are expending a lot of calories, and they should be drinking. If they're coming home saying they're too tired, they don't feel like eating, then you need to let your primary care provider know, the athletic trainer, the coaches know, because that can be a sign. That can be an early sign that they're getting dehydrated and they don't want to eat, they're getting tired, and then that's just going to lead to bigger problems down the road. And listen to them after practices. Let them talk. How is their day? How are things going? Open those lines of communication, because you may pick up on things that could be a mental health stress issue, things like that. And I'm going to put one other thing in there that sounds simple and subtle, but allow them to take time to shower and clean up, whether it's even if you're waiting after practice for them to do that, or if there isn't showers that they get home before you rush off to some other family event that they take, because there are staph and MRSA infections. Again, they're not acute injuries, but can lead to some serious infection. And part of that is just being able to properly shower and clean. And I think sometimes athletes are rushed from one thing to another. They're rushing here and there, and we don't think about that. So
that's a great point. It's simple, but it's fantastic point. Yeah, it's great. In regards to CPR and sudden cardiac issues, could you give us 3 things athletic trainers should remember as we start? So what pearls of wisdom do you see as necessary?
The 3 things athletic trainers should be remembering, or pearls of wisdom I have, is first and foremost, trust your training when something happens. The training that you've been doing will kick in, and go with your first instinct. So if you think you need EMS, then you do, but trust your training. If it's CPR, it will kick in. And if you talk to people who have had to do this, they will tell you similar things. My second big one is check all of your emergency equipment daily. Make sure it's in good working order. I take that out of my EMS side every time before a shift. Even though the shift before us has gone through a truck, we check off everything to make sure it's operating, whether it's the lights on the vehicle to the AEDs or the oxygen tanks, et cetera. And then the third tip, know your EAPs and follow them. So follow your EAPs that you've trained, practiced, and rehearsed, and that training will kick in.
Awesome. What is something you would encourage athletic trainers to learn, practice, or research regarding emergency response, cardiac arrest, and CPR?
What I would encourage ATs to learn from a emergency response to cardiac arrest and CPR is airway management and learning how to maintain a good mask seal with CPR with the BVM. And then I already mentioned MPAs. I'm a big fan of nasopharyngeal airways. All of you are trained in that. Carry them, learn them. If you don't know about them, learn how to use one. You can use it on any patient. And then that team's approach to high quality CPR, sometimes referred to as the pit stop crew or pit crew method of CPR, especially if you have the resources at your school, college, or whatever to assign those roles, can be and has been shown to be highly effective in improving CPR delivery to patients using that method.
Great. Last but certainly not least, can you give us a trick or a tip that you would tell new athletic trainers, whether it be new grads or people coming back into the profession, or even seasoned athletic trainers, to make their job more efficient, fun, or easier?
What's a tip or trick? that I would give to new or even seasoned ATs to make their job more efficient, fun, or easier. The first one I've already mentioned is trust your training. The next one is develop a system of quick reference lists for players for their allergies, medical conditions that are significant, and update that. Now, whether that's on an iPhone app or Google Form or whatever. And then my other big one is always set up your medical equipment, your emergency equipment in the same location in the same way on your fields, whether it's practice, game, et cetera. And what do I mean by doing that, and why is that helpful? When I was a high school athletic trainer, I always set up my sideline treatment table actually at about the 40-yard line closest to our locker room. And I would do that whether it was visiting or home or away. On the left side under the table was the splint bag. Behind it was the crutches, the spine board. And on the right side was the medical bag and other equipment. So I could, from the field, tell anybody, a referee or somebody, go to the 40-yard line on the visiting side, go to that table on the left side, there's a red bag. That's my splint bag. I want you to grab that and bring it out. By setting it up the same way every time, whether it was a game or practice, I can walk out to a practice field if everything's set up the same and notice if something is missing that we haven't brought out. That little bit of consistency in how you set it up instead of just, okay, it's all over here and thrown here versus which side of the table, left or right, is the same, can save a lot of time during an emergency, and allows you to see if you're missing something quickly, so
right, yeah,
that you can get to it.
Perfect. Great. These are all fantastic. Thank you so much, Dr. Fuchs.
You're welcome. Thank you for the opportunity.